What if the air we breathe, the water we drink, or even the noise around us could subtly alter our health? This thought might strike you as an intriguing possibility, a hypothesis that challenges our perception of our everyday environment. Could it be possible that the very elements we consider fundamental and harmless are, in fact, influencing our health in subtle ways? Maybe it seems too fantastical to be true, almost like a plot of a science fiction movie. But let's delve deeper. Consider the air we breathe. We take it for granted because it's invisible, odorless, and ever-present. But what if the quality of the air was deteriorating due to pollution, and we were unknowingly drawing toxic particles into with every breath? Contemplating the water we drink, it nourishes us and keeps us alive. But could contaminated water sources be silently introducing harmful substances into our bodies? Now, ponder about the noise around us. We often perceive it as harmless, a mere backdrop to our lives. But could the persistent sounds of the city, the unending traffic, the constant hum of electronics, be gradually wearing us down, contributing to stress and health complications? In reality, these scenarios are not as far-fetched as they might initially seem. Environmental factors, both visible and invisible, have been scientifically proven to significantly influence our health. From pollution to noise levels, these factors can affect our well-being, often in ways we may not even realize. They can cause silent damage, leading to problems that manifest only after years, sometimes even decades. So it appears that our initial question isn't all that fantastic or improbable. Indeed, environmental factors can and do have a significant impact on our health, often in ways we may not even realize. Take the case of Flint, Michigan in the United States, where in the year 2014, a significant event took place that had far-reaching consequences. The event in question was a seemingly innocuous budget decision. To save some money, the city administration decided to modify Flint's water supply process. They switched the city's water source from Lake Huron and the Detroit River to a more economical option, the Flint River. This decision, made largely to alleviate the burden on the city's stressed financial resources, seemed like a practical solution. However, little did they know that this seemingly smart monetary decision would inadvertently put the city's residents' health at terrifying risk. The Flint River, unbeknownst to the decision-makers, was a highly corrosive water body. This high level of corrosiveness was not initially detected, nor was it anticipated. This unfortunate oversight led to a complex chain of events that had dire consequences for the city's water supply system. The corrosive water of the Flint River, when transported through the city's aging water pipelines, began to cause significant damage. The old pipes, worn and weathered by time, were made of lead. The corrosive water caused the lead from these decrepit pipes to leach into the city's water supply. This led to a widespread contamination problem. Lead, a highly toxic metal, was now freely circulating in the water that the residents of Flint were consuming daily. This resulted in a public health emergency that took the city, the state, and the nation by storm. Lead poisoning began to take a toll on the city's population, with severe effects on its most vulnerable residents. The most horrific impact was seen particularly in children, where it led to developmental issues and neurological damage. Or consider the inhabitants of New Delhi, India, one of the most polluted cities in the world. Nestled in the heart of India, this bustling metropolis is home to over 21 million people. Each day, the city breathes to the beat of honking cars, churning factories, and vibrant marketplaces. It's a city that's famous for its rich history, a city that's a blend of old-world charm and modern energy. However, behind the veil of its infectious energy, it battles an unseen enemy: pollution. The skyline of New Delhi is frequently obscured by a thick grey blanket of smog, making the sun a rare sight for its inhabitants. Residents are confronted with a smog so dense that it often forces shut down schools and businesses, disrupting the rhythm of life in this bustling city. The cause? An unfortunate mix of factors such as vehicle emissions, industrial pollutants, and construction dust, coupled with meteorological conditions that trap the pollutants in the city's air. This toxic air that the citizens inhale daily is equivalent to smoking more than 20 cigarettes a day. an alarming fact that most of the population has reluctantly come to accept as a part of their daily lives. Each breath they take is laden with fine particulate matter, invisible to the naked eye, but searingly tangible to the lungs. Healthcare professionals in the city report a significant increase in patients suffering from respiratory problems, chest infections, and allergies. Children and the elderly, more susceptible to such diseases, are the worst affected. The city's hospitals are teeming with cases of asthma, bronchitis, and other respiratory ailments. More worryingly, prolonged exposure to such poor air quality is also leading to a rise in cardiovascular diseases. This has led to a surge in respiratory and cardiovascular diseases among the city's population. The ticking time bomb of chronic pollution is a harsh reality for the residents of New Delhi, a city that is struggling to breathe amidst its vibrancy and life. Noise pollution is a component of our daily lives that is frequently dismissed, despite its profound impact on our health. This invisible assailant, often overlooked, lurks in our bustling cities and even in our quiet suburbs. It's a pervasive phenomenon that affects millions of people around the world, in ways we are only beginning to understand. Take Europe as an example. In this continent, steeped in history and abundant with diverse cultures, noise pollution has become an unfortunate reality of modern life. The hustle of the cities, the constant flow of people, the ceaseless movement of vehicles, and the hum of technology create a cacophony that rarely ceases. This continuous noise, particularly the clamor of traffic, is more than just an annoyance. It's a serious health concern that is impacting the lives of countless individuals. It's estimated that traffic noise alone in Europe results in over 600,000 cases of hypertension each year. Hypertension, also known as high blood pressure, is a condition that leads to several health risks if not managed properly. It increases the strain on the heart and blood vessels, ultimately causing them to work harder than necessary. The long-term effects of this strain can lead to heart disease, a leading cause of death globally. This silent, often unnoticed form of pollution is therefore not just an issue of comfort or convenience. It's a dire public health issue that merits serious attention. The impact of noise pollution on our health, routinely underestimated, is a crucial area of research that needs more exploration. It's a reality that traffic noise alone causes over 600,000 cases of hypertension annually in Europe, leading to an increased risk of heart disease. This is a stark reminder that environmental factors, often overlooked, can have serious health implications. So what can be done? While it may seem like an insurmountable task, there are steps that can be taken to mitigate these issues. In Flint, steps are being taken to replace the city's old lead pipes, a move that, while costly, will prevent future health crises. Meanwhile, in New Delhi, measures are being put in place to curb air pollution, such as implementing stricter emission standards and promoting the use of electric vehicles. On an individual level, we can also make changes. Simple acts like using less plastic, recycling more, and using public transportation can have a significant impact on the environment and, in turn, our health. In conclusion, it is clear that environmental factors play a significant role in our health. From the water we drink to the air we breathe, and even the noise around us, our environment can have profound effects on our well-being. But by acknowledging these issues and taking steps to address them, we can work towards a healthier future for us all. Remember, it's not just about saving the planet, it's about saving ourselves. After all, there is no health without a healthy environment. So think about it. How will you contribute to a healthier environment today?